Okay, my name is Madison Rose Clegg, and my student number is 22091267. I'm a second year nursing student at Western Sydney Uni. So today I will be discussing the ATE assessment for Mr. David Nazal, as well as high priority nursing interventions and nursing considerations when administering medications and therapies. So, to start, COPD, what is it? So, chronic obstructive pulmonary disease, which is often styled as COPD, is a chronic and long-lasting disease that affects the lungs. So, COPD causes damage to the airways in the lungs, which causes them to narrow and in turn making it harder for the air to move in and out of the lungs. So, the ATE assessment was conducted and these are the findings. So Mr. Nazal's airway is patent. It is clear of any obstructions and he is able to maintain um, his own airway. And although no immediate interventions are currently needed in relation to the airway, it is important to continue to monitor Mr. Nazal's airway um, in case of deterioration. So Mr. Nazal is tachypneic with a respiration rate of 30 breaths per minute. Um, and he is presenting with an oxygen saturation of 78% on room air. It is recommended that those with COPD should maintain oxygen levels within 88% to 92%. So that means that the 78% is low, and it is concerning. So due to the low levels of oxygen in his in the tissues in the blood, Mr. Nazal is he is experiencing, severe hypoxemia, which is indicated in his ABG results with a PaO2 level of 55, as well as hypercapnia with a PaCO2 level of 60. So because of this, Mr. Nazal is in respiratory acidosis, as indicated by his pH level of 7.30. He is also experiencing a shortness of breath and is using accessory muscles. And upon auscultation, it is found that Mr. Nazal has bilateral diminished breath sounds present, with wheezing present and grapples. This could indicate an obstruction in the airway and possible accumulation of fluid. So these results and findings have informed my clinical decision making, determining that it is important to administer supplemental oxygen as soon as possible to help address and correct the hypoxemia and the hypercapnia due to the oxygen saturation being low at 78%. So if the supplemental oxygen is ineffective and the SpO2 levels don't improve, it is possible to consider moving to non-invasive ventilation to help reduce the use of accessory muscle and the work of breathing. It is vital to continue to monitor Mr. Nazal's respiratory status in case of any further respiratory distress. So he's presenting with sinus tachycardia with a heart rate of 128 beats per minute. And he is also experiencing hypertension with a blood pressure of 168/85. So due to the low levels of oxygen in the tissue, Mr. Nazal is hypoxic, which is most likely the underlying cause of his rapid heart rate and elevated blood pressure as his body is undergoing stress because of it. So these symptoms have influenced my decision making and have aided in the choice of clinical intervention. So as stated previously, oxygen is being administered to the patient in order to help improve hypoxemia and hypercapnia, but also to improve hypoxia, which will limit the stress that is being put on Mr. Nazal's body and help aid in the lowering of his heart rate. So Mr. Nazal has a GCS level of 15/14, which has impacted his mental status, which is leaving him confused and distressed. So this is most likely due to the inadequate oxygen in his blood and tissue, as previously stated. It is important to monitor his mental status by conducting neurological assessments and once again improve his oxygenation. So then this will help improve his mental status. And finally, Mr. Nazal is presenting as febrile, which could possibly be from an infection, which this is evident in the lab results, which show Mr. Nazal to have an elevated white blood cell count as well as high CRP. which both suggest infection. It is likely that it has been caused by his positive COVID-19 diagnosis. So due to these findings and vital signs, Mr. Nazal should be started on antibiotics to address the infection and assess and reassess with further testing later on. So 4 high priority nursing interventions. So oxygen therapy. Mr. Nazal's oxygen levels are currently sitting at 78% on room air, which is not ideal as he is living with COPD. So the rationale for administering oxygen is to help improve his oxygen levels and treat the hypoxemia, the hypoxia, and the hypercapnia he is experiencing due to the low levels of oxygen in his blood and tissue, as previously stated. Another 2 nursing interventions that can be used to help manage his COPD exacerbation is the use of bronchodilators and corticosteroids. So bronchodilators are a beta-2 antagonist, and they work by targeting the muscles in the lungs and cause them to relax, which helps the bronchi widen. So bronchodilators are often used in the treatment of COPD, and they should be used in conjunction with corticosteroids. So the corticosteroids are used to treat inflammation. They do this by binding to the glucocorticoid receptor and inhibit the pro-inflammatory signals and response and promote the anti-inflammatory signals. So my rationale for using both of these is to help improve and decrease the hyperinflation of Mr. Nazal's lungs, which we can see in the X-ray provided, and to help him manage the flare-up of the disease and help improve respiratory function. So the 4th and final intervention that can be used is continuous monitoring of Mr. Nazal's vital signs alongside frequent ABGs. So conducting these can help determine whether the other interventions undertaken are effective, as well as inform us if there has been any deterioration with his condition. So then we have nursing considerations when administering medication and therapies. So oxygen and salbutamol. It is important to assess Mr. Nazal's airway, pulse, respiratory rate, just to name a few, before administering oxygen. It also may be worth performing an ABG to get more specific measurements. So whilst there are many different forms of oxygen administration, it's recommended to start with oxygen therapy delivered through nasal prongs and assess as needed. So side effects of oxygen therapy can include dry nose and mouth, headaches, and dizziness. So, before administering salbutamol, it's important to assess respiratory rate, heart rate, breath sounds before and after administration. Assessing heart rate, as there is a possibility that salbutamol can cause tachycardia. So salbutamol can be administered via a nebulizer or an inhaler, and some of the side effects caused by salbutamol can include trembling, headaches, and possible tachycardia, as mentioned. Nursing considerations for Atrovent can include assessing respiratory status, oxygen saturation levels, and taking into account any allergies relating to bronchodilators. It can be administered via nebulizer or an inhaler, much like salbutamol. So side effects that can be taken into consideration relating to Atrovent can include dizziness, nausea, vomiting, and dry mouth. We also have prednisolone, which is a corticosteroid used in the treatment of inflammation. It is important to assess and monitor for any allergic reactions and any potential risks associated with taking steroids. Prednisolone can be administered through multiple routes, including tablet form, an injection, or intravenously, and some side effects to monitor for when someone is taking prednisolone can include headache, an increase in appetite, indigestion, insomnia, and possible mood changes. And then we have azithromycin. So when administering this to Mr. Nazal, it is important to assess for any improvement of the infection first and monitor for any signs of anaphylaxis. This can be administered orally or given through IV if needed. Side effects when taking this antibiotic can include nausea, vomiting, diarrhea, headaches, or dizziness. And then we have I can never say this one. Nirmatrelvir. So it is used in the treatment of COVID-19, which Mr. Nazal has tested positive for. So assess the COVID-19 symptoms and monitor vitals such as respiratory rate, heart rate, and breathing. Check for any drug interactions as well. This drug is administered in a tablet form and can cause side effects including dizziness, cough, nausea, hypertension, and stomach pain. And that's it. So thank you.